Hello ladies, welcome to another video. My name is Nicole and thank you for being part of this big family. So today's topic is do you have to or should you screen every single sex partner in your life before having sex with them? The answer is yes, definitely you have to. If you love yourself, if you don't have any self-esteem issue, if you are not a woman of low self-esteem, you definitely have to screen every single partner, get to know their status before you can actually have sexual intercourse with them. It's really important that you understand that your health has to go first and that people don't usually tell the truth. So yes, the answer is yes, you have to screen. I remember one day when I mentioned this to a mentor, like, oh, I definitely will opt for screening for before any intimacy, and she was like, oh Nicole, you're gonna die alone and lonely. I laughed, and then I laughed because it's okay to die alone and lonely, but not die with syphilis, not die with any sexual transmitted disease or infection. So it's very important that you understand that your health goes first, yes, and that people usually don't tell the truth. So yes, you need to know. You need to know his status as much as you need to know your status. So if you're seeing some sort of unusual things being present in your genitals or private parts or vagina and so forth, you need to inquire. You need to go see a nurse or doctor just to inquire about the whatever that is going on there and what you can actually do in order to fix. But you have to keep an eye on yourself. You have to keep an eye on your health, because it's very important. It's the most valuable asset that you have today. If you get, for instance, a sexual transmitted infection that is caused by a virus which is not curable, so it's kind of going to be a big mess. There's a lot of plans, dreams that you have in your life that you may not be able to carry on with because you'll be stuck with a virus that you can't get out of your system, that will compromise your immune system and definitely affect your life in so many ways. So you really have to look after yourself and make sure that you make the best decision. So the first thing, like we said, definitely you have to screen him. It's very complex. I know it's kind of embarrassing. You can feel embarrassing, you can also feel shy and all of that. So the best way to do is actually to offer to go with him. So you just met this guy, he looks great and everything. You asked him, so how is your sexual history? Oh, I only, slept with 2 or 3 girls in the past. I haven't been in blah blah blah. And then you kind of, okay, I believe you, actually, I believe you because I believe you're telling me the truth, but you have to tell him, babe, can we please go together? Can we get tested together? I want to know, if I'm HIV positive or not, if I have herpes, if I have syphilis, if I have gonorrhea. I just want to know, my status as much as I want to know his status. Because if you tell him to go by himself and get tested, and he may feel shy, embarrassed, or just feel like attacked by you. So to make it easier is to volunteer to actually go with him and get tested together, because you have to know yours as well. So it's very important that for the first point, as we're talking, that you get to know your status. You have to know your status. You have to know his status. You really need to know that. It will help you both to make the best decision if you want to proceed, regardless of his history of any sexual transmitted disease. By the way, a sexual transmitted infection is actually infection that's you can get, via sexual contact. So it doesn't matter if you're gonna have vaginal sex or oral sex or anal sex. Every sex is sex, and when you have it in a very unprotected way, you can easily get sexual transmitted disease. People think condom offer the best protection on coverage. It doesn't, because viruses like herpes, it can always be transmitted from the area where the condom is not actually covering the penis, for instance, and you can easily get the virus. So you're gonna have to screen him so you can get to know what you're dealing with. It's very important for you to do that. So the second thing or point, it's when should you actually volunteer or offer or suggest that you guys should go for a screening. So it's not only when you meet a new person in your life that's very compulsory, but it's also if you are in one of those kind of weird relationship. I say weird, I know, but it's not in a bad way, you know. It's almost this weird in the right way, not right way, in an okay way. Anyway, so if you are in an on and off relationship, so you kind of broke up, you guys got back together, I would suggest that you really consider to go for a screening. Just ask for the STD panel, so they will run all the sexual transmitted disease panel. There will be syphilis, gonorrhea, trichomonas, all kinds of sexual transmitted infections that are being transmitted, infections that are being transmitted sexually that are caused by parasites, viruses, or bacteria. So you get to know what you have in your immune system, in your body, what it also has. So it's very important. So if you're in an on and off relationship, you really need to go and get tested. If you guys have been separated for a while and then got back together, there are couples like that. They are married today and tomorrow they, I don't know, I don't think they break up. They just kind of separate for a while and then they reunite again. So when you guys were separated, we don't know if he slept with another girl, with someone else. People don't usually tell the truth. They will say, no, you've been the only person that I've been with. Get tested. The test result is the best. It's the truth. So there's no way the lab will actually compromise because they have no interest. So if you've been separated with your husband and then reconnect again, both of you guys need to go for a screening. It's very important. If you meet a new guy, you should go for a screening, as well as if you're in an on relationship with your boyfriend. So they are girlfriend and boyfriend. They're together today, and tomorrow they will kind of break up and everything, and then they will get back together. It goes on like a cycle. So if you are in one of those relationships, that's your decision, that's your call. Just get tested before you can sleep with him again, whether you choose to have oral sex, vagina sex, or anal sex. Sex is still sex. You are at a high risk for sexual transmitted infection or for sexual transmitted disease, and condoms do not offer 100% protection and need a contraceptive. So you have to get the panel. You need to see, you know, what is in his system as well as what is in your system as well. That's very important. So the third thing is what we said. You need to ask for it. You wouldn't know that you want to know about your status unless you volunteer. Baby, please, let's go together. Let's get tested. Let's get to know if I'm HIV positive or not, if you have herpes or not, if you have gonorrhea, if you have trichomonas, if you have syphilis. Syphilis, for instance, is not my favorite sexual transmitted disease because it's recurrent. So you can have it today, be treated, I don't know, penicillin or whatever, antibiotics, and then after 15 and 16 years, that's treponemons who can always appear. That's parasites. The parasite, we need to check. Well, can always appear in another form, attack your nervous system and compromise a lot of function in your body, and we don't want that. That's why you need to know if your partner has ever had syphilis in the past, was treated, so you can know what to sign up for the rest of your life. This is will only benefit you. You really need to be smart about it. So another thing, or maybe the fourth point we're going to talk about, is you desiring to know. Don't just be naive. Don't say, oh, okay, he's a pastor's son, or he was married before, you only had a serious relationship with 2 girls and then you trust him with your life. No, you can't afford to be naive. You can't afford to be scared. Your body is precious. Your vagina, or I don't know, genitals is very precious. It's one of the most beautiful assets you have. You can't just give it away. You can't just let it, you know, so available to anyone, or allow anyone to be in and out as best fit them, or as they want to. So you kind of want to protect that dignity. That's most one of the most precious area or organs of your body. So you really have to know. Do not be naive. Do not be scared. A man who really wants you will not run away because you request that. It got tested, so you request to know about his health status in terms of knowing if he was treated with any sexual transmitted disease, or he currently carries the pathogen, which could be the virus, the parasite, or the bacteria. A man who loves you will go with you. A man who loves you can even go, you know, himself. He will give his blood or whatever sample the lab will need. will allow them to run the test, will bring you the result, because he want to show you that he's telling you the right thing and that you can trust him, and that with your health you can trust him, with your body you can trust him, just you can trust him. So it's, don't be shy or scared or afraid, oh, he's gonna run away, he's gonna break up with me, or he's my husband, we've been together for 5 years, he will never sleep with another man. Who told you that? No, you're gonna be smart, you're gonna be more than that, you're gonna give more than that, more than just trust. There's a lot that goes on, my ladies. You cannot afford mistakes, you cannot afford being naive or having a low self-esteem. It's your body, you know, you have the key, you don't have to hand it to anyone if you're not comfortable. So yes. Another point, or the 7th point we'll discuss, is if you choose to date sex workers. So sex workers are people who choose to be part of the seduction industry, like they call it, sex workers. Anyone who is selling their body for money. So we have male prostitutes, we have female prostitutes, or maybe strippers. People also say they are part of the sex world or sex industry, so all of that. So if you choose to date one of them, that's your personal decision, which we have no problem for, because you choose that, that's what works for you. But my advice will be, you have to screen the person. And it's difficult if it's your partner is like a stripper or a male prostitute, because the male prostitute is sleeping with so many girls for money, is giving them oral sex and sex, vaginal sex, and then you are not there, you have zero control. So you choose to date such a man, you really have to do your best to get the test results. You have to ask him to go to the lab or the hospital to donate the blood or whatever sample they require for him, to let the lab run, the complete panel, gets to know if he has HIV, if he has herpes, if he has syphilis, any other sexual transmitted disease or infection that is caused by any parasite, bacteria or viruses. You have to know if he has it, if he's a carrier, or if he was treated in the past, did he follow the treatment, how is he doing, is he having lesion in his penis, testicles, or genitals. You have to know those kind of things. So it's very risky, unfortunately, to date is someone who is in the sex industry, because they sell sex for living, they sell their body for living. They will say, oh, I never have sex. He meant probably he never had a vagina sex, but he kept on giving oral sex to clients. You were not there. People don't usually tell the truth, so you can't afford to be naive, you can't afford to have such a low self-esteem, not inquiring furthermore to know about what your partner's activity, sexual activity are, in order to protect yourself and your health against any sexual transmitted infection or disease. So you have to be very careful whether you will choose to screen all his sexual partners or drop off that kind of job, but you really have to know. And the last point will be just reminding you about the consequences. So like we said, sexual transmitted disease infections are being transmitted sexually, and there are viruses that you can get sexually, like herpes, that condoms do not protect. So if the condom is only covering a piece of the penis, there will be a side of the penis that will not be covered by the condom. And if there is virus on that side of the penis, you are in contact with it, you would definitely get herpes or get the virus or the sexual transmitted infection. So it's really important you understand that, and if you have it, obviously things will change. You may see some lesions, some sore, some wound, you will struggle to pee, or you can even start releasing a bad odor or smell. There's so many distractions that will occur in your vagina or in your genitals, in your life, in your health, that is very bad. And like I said, if you have syphilis, it can always come back after maybe 10, 16 years, 15 or 17 years, if you are not being treated, or if the parasite decide to stay in your body. So you cannot afford to such kind of risk. So you have to screen it, you have to know, and good luck with that. Thank you for watching. I will see you in my next video. Bye.